www.healthsplatform.com – Getting your cholesterol levels checked. If you're aged 20 years or older, the American Heart Association suggests getting your cholesterol levels checked in any event once every 4 to 6 years. In the event that you have a history of high cholesterol or other hazard factors for cardiovascular disease, your doctor may encourage you get your cholesterol levels tested more often. Your doctor can use a lipid panel to measure your total cholesterol level, also your LDL cholesterol, HDL cholesterol, and triglyceride levels. Your total cholesterol level is the general measure of cholesterol in your blood. It incorporates LDL and HDL cholesterol. On the off chance that your levels of total cholesterol or LDL cholesterol are too high, your doctor will diagnose you to have high cholesterol. High cholesterol is particularly perilous when your LDL levels are too high and your HDL levels are too low. Tips: focus on the saturated and trans fats on your blood labels, just as included sugars. The less of these you expend, the better. Close to 10% of your day-by-day calories should originate from either immersed fats or included sugars. Try not to stress over eating enough cholesterol. Your body makes enough whether or not you consume it. Eat more healthy, unsaturated fats. Please feel free to give your comment if you face any difficulty here. Subscribe to our channel for more videos. Thanks for watching.